Will you please explain a little about the PANDA disease, not the black and white little bear, but PANDA disease, and what can be done to best support the patient that has this condition, and what is available at PIH to help with this condition, please?
Well, in medicine, it's important to understand that we're descriptive and we like acronyms. So pediatric autoimmune neuropsychiatric disorders are called PANDAS. And you're right, this is not the little cuddly bears. It's an autoimmune condition that affects children and some adults, but mostly children. And the consequences have to do with sleep, mood, concentration, ability to learn, attention deficit disorder, and the whole continuum of neurodevelopmental disorders. So some young people with PANDAS develop tics. Some young people with PANDAS show their immune defense and repair problems by having recurrent infections, especially strep infections in their throat. And most doctors, clinicians, are taught to deal with the consequences and the symptoms, and they are not taught to deal with the causes. And what are the causes? Too much bad stuff, too little good stuff. What do we mean by the bad stuff? We mean the anti-nutrient, oxidative, in the persisting pollutants that are mostly hormone disruptors, the solvent residues called volatile organic chemicals, the toxic metals, the mold products, the radioisotopes, all of which are anti-nutrients, which means they deplete the good antioxidants, buffering minerals, essential cofactors that you must have to survive. Indeed, most people with this PANDA syndrome are in survival mode, and we want to get them back into elective protective mode. And how do we get them back into elective protective mode? Well, we do the 4 self-assessments. We include the 8 predictive biomarkers, and you will find that these people are taking too much sugar and too little fiber. They're taking too much processed food, too little whole food that they can digest, assimilate, and eliminate without immune burden. And we can, through the 4 self-assessments and the 8 predictive biomarkers and our ability to help you understand the meaning of those results, interpreted to best outcome goal value, put into remission what's called PANDAS. So it is a syndrome, it's a complex syndrome, it affects every part of the person. And the answer is to get to the cause, not just treat the consequence.